Good morning, everyone. Today, I would like to speak a few words about importance of dental care in primary education. We all know dental health is directly related to systemic health. Dental health is a mirror to systemic health. Often, we tend to ignore this very important fact. And children, when they develop habits or when they mold themselves to practice good practices, as an adult, they will have a better quality of life. So, what is very important is when a child has got better oral health care or a better dental practice, he will have or he or she will have a good quality of life, which will enable them to have a good performance at school, both academically and otherwise. Very important to have a diet counseling session as well, which will help them to develop a systemic health. So what can happen if you do not have a proper primary education, both in terms of parents as well as by school authorities? What will happen is you will have a child with a lot of dental caries, with a lot of gum diseases. The child, because of these dental caries and gum diseases, will have a low self-esteem, which will affect his emotional behavior. He may have issues with the speech if he has not taken care of a good oral health care. He may develop as serious diseases as heart disease, respiratory disease, and dementia. So that is the reason I've mentioned oral health is a reflection of systemic health, and this is very important for a child to take care in his early age. So if you can see here, he can have a dental caries, which can create a very big problem, both aesthetically and functionally. Child being very sensitive at a tender age, he may have issues with emotional issues in socializing, in approaching people, in communicating. All these are very intricate issues which he can develop over the time. He can have gum disease, and this, as I've mentioned, is a very serious implication. It doesn't stop at the oral health, but it also extends almost to the systemic health. And because there have been studies which reported gum health is very important to make sure that there is no problem with the systemic health, as maybe heart problems or lung problems and so on. This is a very important aspect we have to consider in the modern living era, which is so low self-esteem. Children who do not have high self-esteem or they cannot take care of their esteem will have issues later to deal with a lot of issues in their adulthood. And this has been proven psychologically. The child, when he's affected with some sort of issues at a tender age, will have problems later in life. As I mentioned, emotional and mental health problems are maybe directly related to oral health, because oral health is what makes a child to interact with people and so on. As I mentioned, respiratory diseases are also possible complication with oral health issues. Dementia, surprisingly, that dementia is not only limited to old age or after adulthood, but dementia can happen during the primary education age as well, because dementia can cause problems with performance again at the school, and as a result, the student cannot be focusing well, and student will not get good grades, and the vicious cycle continues on. Problem also with the speech issues, and speech issues we all know, communication is a very important aspect nowadays in the modern era, where kids have to do a good communication to get what they want to achieve in life. So speech issues have to be taken care, and these speech issues can be intricately related to, again, complete oral health care. So what should be done? For this, we have twofold problems to be addressed. One, at home. Two, when the child comes to school. That means the primary education all over the world should concentrate a lot on the oral health care. At the same time, we have to introduce concepts which we have to make sure that all which is related to oral health should be included in the school curriculum. It can be given by the industry experts, like for example, in Masa International School, we do have these projects where we talk to students how to maintain their oral health right from class 1. So what happens is the kids will know how to develop these good habits, which will be reflected there for them throughout their life. As a dentist or as an endodontist, what I observe most of the times is that the parents are one of the reasons why the kids are worried about their oral health, or if the problem comes. In our terminology, we call it as subjective symptoms, where they're much worried to go to a dentist because somebody told dentist is a very, if you go to a dentist, you'll have a lot of issues, you'll have a lot of problems. But on the contrary, if you develop or instill these particular good practices during the school, later in life they will not have any issues to maintain their oral health every 3 months or every 6 months. And what we do at our university or at our school is we make sure that we have a very good positive reinforcement and repetitiveness. We create an awareness for the students. They come to Masa University, we show them how we do cleaning, we do how we take care of teeth. We make sure that their oral health is maintained at every stage of their class. Every 6 months, we do have a routine checkup, and we make sure that it is done regularly and periodically. We make sure that learning experience at the university or at the school is also taken care in incorporating these good habits of perfect primary education, which make sure the dental practices are taken care as well. And we also make sure the implementations and considerations, including intervention type, we realize theoretical explanation is not enough in primary education, but also experiential learning, where we expect the students to understand how the brushing has to be done. We take care of those setup. We make sure we have a project. We ask the students to go and bring back what can happen, what can go wrong, and so on. And we also make sure the learning is very socially conducive. We do not want to make it very didactic. We will make sure that the student understands what we are trying to talk when we talk this particular thing in the primary education. So overall, the primary education, the child is at a tender age, but at the same time, is like a sponge. He can absorb things very well. And this good habit or good practices, if you can instill at the primary education, this is what we expect them to carry on throughout their life, and they can have a very good oral health, which in turn will be helpful for their systemic health, as I mentioned earlier. So the school education-based program, as I've mentioned, we have got two ways of doing it. One, we go to the school. Two, the kids come to us, our university, where we have got a faculty of dentistry, and people come, they observe, they look at positive remodeling. We make sure that their cognitive behavior is not changed, and these things we make sure and they adopt to better practices. We also have this concept of follow-up. We have to make sure that kids are followed up every 3 months, and a routine dental checkup. What we have to understand at the primary education level, there are a lot of teeth developing. It's a natural phenomenon, of course. It's a natural process where you shed the teeth, the deciduous tooth will go and the permanent tooth, the milk tooth will go and the permanent tooth will come up. But we have to monitor this very, very carefully. We have to understand at this age, there can be some sort of malocclusions, that is, which can have issues with how the teeth are arranged, So this can later have a cosmetic implications. So at this age, in the primary age, or primary education, if we can make sure, whatever can be corrected, we call it as some bad habits which can relate to oral health care, if they can be corrected, we do have a better prognosis or better treatment option. So again, touching the primary education is very, very important, even to make sure there is no malalignment or misalignment of the tooth. We all know, and we hear it many times whenever we go to a dentist says you regularly brush your tooth for 2 times, you floss your tooth, you do this and do that. We have a big misconception, especially parents do have a misconception that it's a primary tooth, milk tooth, it will go. But what we fail to realize is, at this age, if you don't maintain a good oral hygiene, it will have an implication for a permanent tooth. So what we have to understand is, even at a primary level, the kids should be taught how to brush properly. Kids have to be taught that they have to brush twice a day. They have to floss. They have to make sure the teeth are maintained well. So this is very, very important, and this should be a routine thing in their daily life. You know. And one more important thing we all fail to address, especially we are in Malaysian scenario. Malaysia has got highest diabetes in the world. So the sugar consumption in Malaysia is one of the maximum in the world. The statistics show that Malaysia consumes a lot of sugar. So this is very important, and this definitely is going to reflect on your child's overall health as well as dental health. Because you give kids a lot of chocolates, you give kids a lot of sugar, you give a lot of sweets, and of course this will have an impact on child's dental health. As we all know, cavities are made because kids eat a lot of sugar, especially those sugar which is refined, which people eat and that gets stuck in the mouth, and that will lead to problems later in terms of cavities. So we have to make sure diet counseling should be a very, very, very important part, both at your home as well as we do at Masa International School, where we take care of the part of diet counseling, where we try to give them very nutritious food, and we make sure that they do not have issues with their oral health later in life. So just to conclude this short speech, where I would like to express primary education of dental practices is very, 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 very crucial for developing a kid into an adult who can take care of his or her oral health. Oral health, as I've mentioned, again is a mirror for systemic health. You maintain your oral health, you maintain your systemic health effectively. At the same time, you, in the later life, as simple as a bad breath can push people away. People don't communicate with you because you have a bad breath. So, from simple to complicated things, we can avoid if we can take care of a good oral health education or best dental practices very early age of primary education. With this, I would like to thank for all of you for hearing patiently. Thank you very much. See you all at another time. Thank you.